My name is S.J. Olshansky. I'm a professor of public health at the University of Illinois at Chicago. My primary area of expertise is aging and longevity, but I have worn other hats in my life, one of which was a focus on childhood obesity and the effects of increases in body fat on life expectancy among future generations. So I have merged what happens early in life with what happens late in life. It's easy to be passionate about something that influences basic public health, especially for children. We've seen a very unusual event happen just in the last 50 years, which is a pretty dramatic increase in the prevalence and severity of childhood obesity. I come from the United States, so we have wonderful experience at doing just about everything wrong. You can learn from our mistakes. We can tell you exactly what we did, why we did it, why it led to the obesity of an entire generation. We can document its impact on public health. We can show you how it influenced diabetes, cardiovascular disease among these kids when they made it up into their 20s, 30s, and 40s. We can show you the negative effects of accumulating body fat early, and it's only going to get worse as these generations get older. It's an entirely preventable problem, but we are battling against our basic biology, a biology that says retain these calories at all costs, and it's a very difficult battle to enter into, but it's one that can be won. So a lot of people don't quite realize how important storing body fat is. It is conserved across a broad range of species. We're not the only ones that do it. All of these species store body fat extremely effectively, and that fat storage is protected by fundamental, powerful biological mechanisms. We have to battle against that, and we have to realize that it's a difficult battle because of our underlying biology. Second problem probably is the magnitude of the effect of childhood obesity or childhood accumulated body fat on subsequent health. We probably didn't quite know what the impact would be. I mean, what happened in the 1970s with this large generation of children that accumulated body fat, we didn't know how rapidly it would influence the health status of the population. We didn't know how much of an impact it would have on life expectancy. As it turned out, it was dramatic. So you can learn certainly about the mistakes that we made and its impact, and probably what people are learning now for the first time is the magnitude of the effect on public health that early childhood obesity has on subsequent generations. Health and Wellbeing Queensland is zeroing in quite specifically on the health of an entire generation, and not just an entire generation of existing children and the ones that preceded them that are teenagers and in their 20s who also have risks, but they want to influence future generations. And I think that's the exciting part of what's going on here, is the ability to fundamentally change the relationship that we have, that you have, with food. And that's the mistake that we made in the United States long ago, was we introduced all kinds of high fat, high sugar, high salt foods inexpensively, and it influenced an entire generation. Something similar has happened here, and the effort that's going on here is really designed to combat that problem. Well, the most important message, if it isn't obvious, is that this is a fixable problem. That's what we're here for, is to identify exactly what the nature of the problem is and where to intervene. Fortunately, once you understand the mechanics of body fat accumulation and how the body protects that fat storage, there are multiple ways, pathways, where we can intervene and influence that entire process. One of the most important in the end is going to be how we train children to have a new relationship with food. If there's any equivalent of a fountain of youth, and I use that in quotes, fountain of youth, that exists today, it would be exercise. Just getting out and walking every day, or other types of exercise. It's like an oil lube and a filter for your car. You don't have to do it, but when you do it, it makes your car operate more efficiently. Exercise makes your body operate much more efficiently. This is the first step that's required. to influence public health for an entire generation. It's a wonderful thing to see. I wish we had done this in the United States 50 years ago, 30 years ago, even 10 years ago.